And as you know, diabetes is a deadly disease and it can be associated with neuropathy, ulcers, and can really change the course of a patient's life if not taken care of. Welcome back to another episode where I help younger physicians decrease stress and increase income by transitioning from corporate to independent practices, even without any business experience. So this week's story is about a patient who loved her dogs. And she had probably 3, 4, 5 dogs in her house. And she had multiple visits to my office for diabetes that had been really uncontrolled, and tried multiple things, multiple medications, but ultimately I think there was a lot of non-compliance with her. And so one day I got a call from the emergency room, and a patient was going to be admitted for a great toe amputation. And I asked the ER doc, so how did this happen? And apparently her dog ate her toe. And yes, that's what you heard. Patient had neuropathy, she had ulcers, and had an open wound. And unfortunately, one of her dogs got a hold of her toe and had it amputated. And I think the surgeon actually wanted to see if we can locate the toe and see if we can reattach it. And actually, it was a good friend of mine, Jude Farley-Pierre, a podiatrist, who actually did the surgery and called me on this case. We actually had a great conversation in episode 19 of the podcast, if you want to listen to that. So I saw her as a follow-up to this, and she said she was not going to get rid of her dog, and she loves her dog so much that she just couldn't bear to do that. And I'm a dog lover. I have dogs in my home, and I would certainly understand a patient's desire not to get rid of their dogs. But the story gets a little worse. A couple weeks later, I get a call from the emergency room again, and sure enough, her dog ate another toe. So why am I sharing this story? Well, I think we as physicians need to understand that we can't change patients, and it's ultimately their responsibility to take care of themselves. We can guide them, we can shepherd them, we can help prescribe the best medications for them, but ultimately it's their choice. And I hope that this never happens to another patient, but it's interesting that I've actually shared the story before, and I've had other doctors say that they've had this happen to their patients. So yeah, it's a pretty gross story, but it's unfortunately reality. Do you want to hear more stories like this? Subscribe to our podcast and never miss an episode.